My name is Dr. Benjamin Miles. For 22 years, I was a heart surgeon at Carolina Regional Medical Center in Winston-Salem, North Carolina. I performed my first open heart surgery in January of 2002, and my last one in early November of last year. That's over 5,000 operations. 5,000 times I opened a human chest, held a beating heart in my hands, and put that person back together. I walked away from all of it 6 weeks ago. People ask me why I retired early at 53 years old. My colleagues at the hospital think I burned out. My wife Karen thinks I'm having some kind of midlife crisis. My 2 daughters think I just wanted more time to play golf and spend with the grandkids. I let them all believe whatever makes sense to them. The truth is something I can barely speak out loud, even to myself. What I'm about to tell you happened. I have witnesses, I have video recordings, I have medical records that document every impossible detail. But the moment you tell people you've seen something that shouldn't exist, something that violates the basic laws of medicine and biology, they stop listening. They smile politely and change the subject. They suggest you've been working too hard. They recommend a vacation, so I stopped trying to convince anyone. Instead, I simply left. Because once you've seen what I've seen, once you understand that the human body can be something other than what we've believed for centuries, you cannot in good conscience continue pretending everything is normal. Let me start at the beginning. Carolina Regional is a large hospital, not quite as big as the famous medical centers up in Durham or Chapel Hill, but we handle serious cases. Our cardiac unit is on the 6th floor. We have 4 operating rooms dedicated just to heart surgery. I spent most of my career working in operating room 2 with the same team. Patricia Coleman, my scrub nurse who'd been with me for 14 years, Dr. Marcus Bowen, my anesthesiologist and probably my closest friend at the hospital, and Dr. Sophia Turner, a talented young resident in her final year of training. We were good at what we did. We worked together like a well-oiled machine. In 22 years, I'd lost very few patients on the operating table. You develop a certain confidence after thousands of successful surgeries. You think you've seen everything. You think you understand how the human heart works. I was wrong. It was a Wednesday morning, October 9th of last year. I remember the date exactly because I've replayed that day in my mind about 1,000 times since. I got to the hospital around 6 in the morning, same as always. Had my coffee in the doctor's lounge while reviewing the day's schedule. We had 3 heart surgeries lined up. The first 2 were fairly routine. A valve replacement for a woman in her 60s whose heart valve had worn out over time, and a bypass surgery for a man in his mid-50s with blocked arteries from years of high cholesterol. The third case was a man named Cameron Dalton, 43 years old, high school history teacher, perfectly healthy his whole life, never smoked, exercised regularly, no family history of heart problems. Then one evening after work, he had a massive heart attack, just collapsed in his classroom while grading papers. They rushed him to our emergency room, stabilized him, and ran all the tests. His heart's main arteries were almost completely blocked. It made no medical sense. People don't just develop that kind of severe blockage overnight, so especially not young, healthy people. But there it was on every scan we did. We scheduled him for emergency bypass surgery. The procedure is called a CABG, which stands for coronary artery bypass graft. Basically, we take healthy blood vessels from somewhere else in the body and use them to create detours around the blocked arteries in the heart. It's delicate work, but I'd done it hundreds of times. That morning, I met with Cameron and his wife Jennifer in his hospital room before the surgery. He was nervous, which was completely normal. Jennifer held his hand tight while I explained what we were going to do. "Mr. Dalton, I'm going to be straight with you," I said. "This is serious surgery, but you're young, you're otherwise healthy, and we caught this before your heart sustained permanent damage. Your odds are very good." "Will I be okay, Dr. Miles?" he asked me directly, looking me right in the eye. "I'm going to do everything in my power to make sure you are," I told him, and I meant every word. We brought Cameron into the operating room at 9:45 that morning. Dr. Bowen put him under anesthesia, and by 10 minutes after 10, he was fully asleep, breathing tube in place, ready for surgery. At 10:17, I made my first cut down the center of his chest. We use a special saw to cut through the breastbone so we can open the chest cavity and reach the heart. The whole team had done this so many times we barely needed to speak. Everyone knew their role. I placed the retractors to hold his chest open, exposing the protective sac around his heart. At 10:23, I cut through that sac and got my first clear look at Cameron Dalton's heart. It was beating normally, strong, steady rhythm, but something about it caught my attention immediately. The color was off. A healthy heart has a deep reddish color when it's getting good blood flow. Cameron's heart looked almost gray, like stone. In all my years of surgery, I'd never seen cardiac tissue that particular color. "Patricia, can you adjust the lights?" I asked. "The tissue looks strange to me." She turned up the overhead surgical lights to full brightness. The gray color remained. "Dr. Bowen, what are his vital signs?" I called out. "Perfect," Marcus replied from his station at the head of the table. "Heart rate is 72, blood pressure is 120/80, oxygen levels at 99%. Everything looks great." I pushed the observation aside. Sometimes lighting can play tricks on your eyes. Sometimes tissue just looks a little different from one patient to another. I proceeded with the standard steps of the operation. For the next 45 minutes, everything went normally. We harvested a blood vessel from Cameron's chest wall and some vein segments from his leg to use as bypass grafts. Dr. Turner assisted me while Patricia kept all the instruments organized and ready. At 11:08, we were ready for the most critical part of any heart surgery. We needed to connect Cameron to the heart-lung machine. This machine temporarily takes over the job of pumping blood and adding oxygen to it, which allows us to stop the patient's heart completely so we can work on it without it moving. We connected the tubes from the machine to Cameron's major blood vessels. At 11:12, the heart-lung machine took over his circulation. All the monitors showed perfect numbers. Blood flow was good, oxygen levels were excellent. At 11:17, I prepared to stop Cameron's heart. We do this by injecting a special solution called cardioplegia directly into the heart's blood vessels. It's basically a very high concentration of potassium, which stops the heart muscle from contracting. Every single heart responds to this solution the same way. It's as reliable as gravity. Give the injection, wait 30 to 60 seconds, and the heart stops beating, always, without exception. I injected the cardioplegia solution into Cameron Dalton's heart. We all watched and waited. 30 seconds passed. The heart kept beating. 60 seconds passed. Still beating. 90 seconds. The heart continued its steady rhythm, completely unaffected. "That's odd," I said out loud. "Let me give another dose." I gave a second injection, this time a larger amount. We waited again. Nothing changed. The heart beat on, 72 times per minute, exactly the same as before. "Dr. Bowen, are you seeing this?" I asked. "I'm seeing it," Marcus replied, and I could hear the confusion in his voice. "That shouldn't be possible, Ben. That concentration of potassium should absolutely stop the heart. Patricia, can you get me a fresh bag of cardioplegia solution from the pharmacy?" I said. "Maybe this batch is defective somehow." While we waited, I tried a third injection from the original bag. Same result. The heart ignored it completely, as if I were injecting plain water. Patricia came back about 6 minutes later with a brand new bag, sealed from the pharmacy, concentration verified. I injected it. Nothing. The heart kept beating with the exact same steady rhythm. "This is impossible," I said, more to myself than anyone else. "The heart muscle literally cannot keep beating with this level of potassium in it. It's not about being resistant or tolerant. It's basic biology. Cardiac cells cannot maintain their electrical activity in this chemical environment." "What do you want to do?" Dr. Bowen asked quietly. I stood there staring at Cameron's heart, my mind racing. In 22 years and over 5,000 surgeries, I had never, not once, seen cardioplegia fail to stop a heart. Not once. It had a 100% success rate. You could depend on it the same way you depend on the sun rising in the morning. "Everyone hold position," I said. "Let me think." The patient was on the heart-lung machine, which was doing all the work of pumping blood through his body. Technically, it didn't matter if his heart was beating or not, except that we couldn't safely sew the tiny bypass grafts onto a moving target. The coronary arteries we work on are only about 2 or 3 millimeters wide, roughly the thickness of a pencil lead. You need the heart to be completely still to attach grafts to vessels that small. Dr. Bowen, let's try some medication to slow the heart rate down, I said. Give me esmolol intravenously. Marcus administered the drug, which is specifically designed to slow down the heart. We watched the monitors. Cameron's heart rate didn't budge. Still 72 beats per minute, unchanged. No response, Marcus said. Ben, that's not normal either. That medication should definitely have some effect. At this point, Dr. Turner spoke up. Dr. Miles, what if we try to pace the heart? Override it electrically? It was a good suggestion. I placed temporary pacing wires on the surface of Cameron's heart. Pacing works by sending electrical impulses that force the heart to beat at whatever rate you set. In theory, I could pace the heart very slowly, giving me windows of stillness to work. I activated the pacemaker, setting it to 20 beats per minute. Nothing happened. The heart completely ignored the electrical signals, maintaining its steady 72 beat pace. It's not capturing, I said. The heart's not responding to the pacing at all. I increased the voltage, tried different settings, changed the position of the wires. Nothing made any difference. The heart beat on, unaffected. By this point, we'd been trying to stop Cameron's heart for almost 30 minutes. Patricia stood motionless, waiting for instructions. Dr. Turner kept glancing at me with worried eyes. The only sounds in the operating room were the rhythmic swoosh of the heart-lung machine and the steady beeping of the monitors. Ben, Marcus said quietly, using my first name, which he only did in serious situations. We need to make a decision. We can't keep him open much longer. He was right. Every extra minute increased the risk of infection and complications. I had to either finish the surgery or close him up without completing the repair. I made a decision that still haunts me. I'm going to operate on the beating heart, I said. We have no choice. I'll time my work to the rhythm, work between the beats. Some surgeons do beating heart surgery, so it can be done. What followed were the most difficult 2 hours of my entire career. I had to place each tiny stitch during the split second between heartbeats when there's minimal movement. It required perfect timing and absolute concentration. One wrong move, one stitch placed during a contraction instead of between contractions, and I could tear the delicate coronary artery. But here's what made it more than just technically challenging. Here's the part that still makes my hands shake when I think about it. Cameron's heart never varied its rhythm, not by a single beat, 72 beats per minute with such absolute precision that it seemed mechanical. A normal human heart naturally varies its rate constantly, speeding up and slowing down slightly in response to countless factors. That natural variation is actually a sign of a healthy heart. But Cameron's heart beat with zero variation. It was like working on a machine, not a living organ. And the tissue felt wrong under my instruments. Heart muscle has a particular texture and warmth that you can feel even through surgical gloves. Cameron's heart felt cold and firm, almost rigid, despite clearly being alive and functioning. When I placed stitches into the coronary arteries, the tissue didn't respond the way it should. It didn't bleed normally when punctured. It didn't react to being touched. Dr. Miles, Sophia said quietly, does the heart muscle feel unusual to you? Yes, I replied. I don't know how else to describe it. It's like we're operating on something that looks like a heart, but doesn't quite behave like one. At 12:41 in the afternoon, I completed the last bypass graft. All 3 grafts were in place, blood flowing through them perfectly. The surgery was technically successful, but Cameron's heart continued its unwavering rhythm, completely unaffected by everything we'd done to it. Let's come off the heart-lung machine, I said. This is normally a critical moment. We gradually let the heart take back the job of pumping blood. Sometimes the heart struggles after being on the machine. Sometimes it takes a while to recover its strength. Cameron's heart transitioned flawlessly. As we reduced the machine's support, his heart maintained perfect blood pressure and circulation without the slightest difficulty. Vitals are rock solid, Dr. Bowen confirmed. Honestly, this is the smoothest transition off bypass I've ever seen. That statement should have been reassuring, but it only deepened my unease. Because he was right. This was too smooth, too perfect. Cameron's heart acted as if the entire surgery had been routine, as if it hadn't just spent 2 hours being operated on while refusing to stop beating. I closed his chest at 134, using standard technique. Wired the breastbone back together, closed the layers of tissue and skin, applied the dressings. We moved Cameron to the cardiac intensive care unit at 152. I gave my report to Dr. Logan Price, the ICU doctor on duty, explaining what had happened during surgery. Logan listened with increasing skepticism. "Ben, are you telling me you couldn't stop the heart with cardioplegia?" "That's exactly what I'm telling you. It had no effect. Nothing had any effect." "That's not medically possible," Logan said flatly. "I know," I replied, "but everyone in that operating room saw it happen. Dr. Bowen was there, Dr. Turner, Patricia. We all witnessed it. And Logan, the heart tissue felt wrong. The color, the texture, the temperature. Everything about it was slightly off." Logan frowned. "Could it be some kind of unusual electrical problem with his conduction system?" "I don't know," I admitted. "I've never seen or read about anything like this in my entire career." "We'll monitor him closely," Logan said. "Run more tests. Maybe we'll figure it out." Cameron woke up from anesthesia at 4:27 that afternoon. His recovery was textbook perfect. No confusion. Fully alert, speaking normally. His vital signs were absolutely stable. Heart rate, 72 beats per minute, never changing. I visited him around 6:15 that evening. He was already sitting up slightly in bed, breathing on his own after we'd removed the breathing tube early. He looked remarkably well for someone who'd had major heart surgery just hours ago. "Dr. Miles," he said, his voice a bit hoarse from the breathing tube. "Thank you. The nurses tell me everything went well." "The bypass grafts are working perfectly," I said honestly. "Blood is flowing well around the blockages. But Cameron, I need to ask you something. Have you ever been told you have any unusual heart condition? Anything about your heart rhythm?" "No, never," he said. "My yearly physicals were always completely normal. This heart attack came completely out of nowhere." "Do you remember anything from before it happened? Any unusual symptoms or strange feelings?" He thought for a moment. "Not really. I remember I was at school grading history papers in my classroom after the students left. It was around 6 in the evening, Tuesday, October 1st. I felt this sudden pressure in my chest and then intense pain. I called 911 right away. October 1st, 5 days before we operated. I made a mental note. Cameron, did anything unusual happen that day? Anything at all? Even if it seems unrelated to your heart?" He looked puzzled. "I don't think so. Just a regular Tuesday. Taught my classes, graded some papers, went home." "Why do you ask?" "Just trying to understand your case better," I said. "You're a medical mystery to us." He smiled weakly. "Well, I'm just glad to be alive." Over the next 4 days, I checked on Cameron multiple times. His recovery was unlike anything I'd seen in my career. Typically, bypass patients spend at least 5 to 7 days in the hospital. They struggle with pain, have trouble moving around, need time to heal. Cameron showed none of this. He had almost no pain despite taking very little pain medication. By day 2, he was walking the hallways. His surgical incisions were healing at an impossibly fast rate, and his heart rate never once deviated from 72 beats per minute. Not during sleep, not during physical therapy, not during stress tests, always the same, constant, mechanical. Marcus, Sophia, and I reviewed the case obsessively. We watched the video recording of the surgery 3 times, confirming what we'd witnessed. The cardioplegia had no effect. The pacing had no effect. We checked every piece of equipment, every medication, every solution we'd use. Nothing was defective. Nothing explained what happened. On day 4 after surgery, we ran additional tests on Cameron. Advanced heart imaging, electrical studies of his heart's conduction system, extensive blood work. Most tests showed normal post-surgical findings, except for one thing. The laboratory supervisor called me directly about a specific result. Cameron's troponin levels, which are markers of heart muscle damage, were undetectable, completely absent. After a massive heart attack and major heart surgery, his cardiac damage markers should have been significantly elevated for weeks, but there was nothing. "Dr. Miles," the lab supervisor said, "I've run this test 3 times on fresh samples. These results don't make sense. His heart should show evidence of damage, but according to these markers, it's as if nothing happened to him at all." I had no explanation to give her. That evening, I was sitting in my office trying to make sense of Cameron's case when Dr. Emily Foster, his cardiologist, called me. Emily was the doctor who'd done Cameron's initial heart catheterization to identify the blocked arteries. "Ben, I need you to come look at something," she said. "Right now." I went down to her office. She had multiple computer screens showing heart imaging studies. "This is Cameron's catheterization from October 4th, before his surgery," she said, pointing to the screen. The images clearly showed 3 severely blocked coronary arteries, 90% blocked in several places. Then she pulled up a new set of images from a catheterization we'd done that afternoon to check how the bypass grafts were functioning. "The bypass grafts look perfect," she said. "Excellent blood flow. But Ben, look at his original coronary arteries." I leaned in closer. The coronary arteries that had been 90% blocked just 6 days earlier were now completely clear. No blockages whatsoever. No plaque. They looked like the arteries of a healthy 20-year-old. "That's impossible," I whispered. "I know," Emily said. "I've had 2 other cardiologists review these images independently. We all see the same thing. His native coronary arteries are now completely normal, as if he never had heart disease at all." "Could we have misread the original images?" "Absolutely not," she said firmly. "I performed that catheterization myself. I saw those blockages with my own eyes, and now they're gone." I felt a chill run down my spine. "Emily, what are we dealing with here?" "I don't know," she said quietly, "but I don't think this is a medical condition we're looking at. I think it's something else entirely." I wanted to argue, to insist there had to be a rational explanation, but I couldn't find one. That night I didn't sleep. I kept seeing Cameron Dalton's heart in my mind, beating with that unnatural precision, gray and cold under the surgical lights. The next day, October 14th, Cameron was discharged from the hospital. Medically, there was no reason to keep him. He was stable, pain-free, mobile, showing 0 complications. It was the fastest recovery from bypass surgery I'd ever seen. I met with him before he left. He actually looked better than before his heart attack, healthier, almost younger somehow. "Dr. Miles," he said, shaking my hand firmly, "I can't thank you enough. I feel amazing. Better than I have in years, actually." "Cameron, I want you to promise me something," I said. "If you notice anything unusual, anything at all about how you feel or how your body is working, I want you to call me immediately." "I will," he promised. "But honestly, I feel better than ever, like I've been given a second chance." He walked out of Carolina Regional Medical Center that afternoon with his wife Jennifer, looking like a man who'd never been sick a day in his life. I thought that was the end of it. I desperately hoped it was. Then on October 23rd, another patient came through our emergency department. 39-year-old woman named Olivia Brooks, presented with the exact same clinical picture as Cameron Dalton. No cardiac history whatsoever, sudden massive heart attack, 3 severely blocked coronary arteries on catheterization, scheduled for emergency bypass surgery. Dr. Eric Davidson, one of the other cardiac surgeons in our group, performed her surgery on October 25th. He called me into his office that evening. I knew from his face before he said anything. "Her heart wouldn't stop, Ben," he said quietly. "The cardioplegia did nothing. The pacing did nothing. I had to do the entire bypass surgery on a beating heart. In 20 years of cardiac surgery, I've never experienced anything like it." "Did you notice anything else unusual?" I asked carefully. "About the heart tissue itself or the rhythm pattern?" His eyes widened. "How did you know?" "Yes, the heart was grayish, cold to the touch, and the rhythm was exactly 72 beats per minute, never varying even slightly. It felt like I was operating on a machine instead of an organ." I told him about Cameron Dalton. We compared notes in detail. The cases were identical in every impossible aspect. "We need to report this," Eric said. "This is beyond unusual. This is something completely unknown to cardiac medicine." Over the next week, we documented everything thoroughly. We presented both cases to the hospital's medical review board. The response was skepticism bordering on dismissal. Our colleagues suggested we'd made errors in our protocols, that we'd misremembered details due to stress, that equipment must have malfunctioned despite our documentation showing otherwise. The medical establishment doesn't have room for impossible events. There's always supposed to be an explanation, always a rational answer rooted in science. To admit otherwise would undermine the very foundation of modern medicine. But then Olivia Brooks was discharged on October 29th, just 4 days post-op, with the same unprecedented recovery as Cameron Dalton. Her follow-up catheterization showed completely clear coronary arteries, exactly like Cameron's. The severe blockages that had necessitated emergency surgery had vanished. On November 3rd, I received a phone call from an unfamiliar number. When I answered, a man's voice said, "Dr. Miles, my name is Hunter Simmons. I teach at Jefferson High School with Cameron Dalton. I need to talk to you about him." We met at a coffee shop near the hospital that afternoon. Hunter was a man in his late 40s, with graying hair and deeply worried eyes. "Cameron's different since the surgery," he said without preamble. "I've known him for 9 years. We're good friends. But something changed. He's not quite himself anymore." "What do you mean by different?" I asked. "He's more efficient, more precise in everything he does. He speaks in slightly odd patterns sometimes, like he's choosing his words too carefully. Last week I watched him grading a stack of essays, and his hands moved so fast I could barely follow them. And his eyes, Dr. Miles. Sometimes when he looks at you, his eyes move too smoothly, like a camera panning rather than the way human eyes naturally move." The chill returned to my spine. "Has he said anything unusual about how he's feeling?" "He told me he feels optimized," Hunter said. That was his exact word, optimized. Who describes themselves that way? I had no answer for him. "Dr. Miles, what happened to him in that surgery?" "I don't know," I said honestly. "I performed a standard bypass operation. I saved his life. But something happened that I don't understand and can't explain." Hunter left looking more troubled than when he'd arrived. That night, I accessed our hospital's medical record system and searched for something I'd been avoiding looking into. I searched for patients with similar presentations over the past several years. Previously healthy people with sudden severe heart disease requiring emergency surgery. I found 11 cases at Carolina Regional Medical Center over the past 3 years. 11 patients with the exact same pattern, all operated on by different surgeons. Different ages, different backgrounds, but all showing the same sudden unexplained blockages requiring emergency bypass surgery. I started calling the surgeons who'd performed those operations. 5 of them remembered the cases clearly. They all described the same impossible findings. Hearts that wouldn't respond to cardioplegia, unusual tissue characteristics, unnaturally precise cardiac rhythms. But like Eric and me, they'd been dismissed when they reported the anomalies. Eventually, they'd stop talking about it, convinced themselves they must have been mistaken. All 11 patients had made remarkably fast recoveries. All showed clear coronary arteries on follow-up imaging, despite having severe disease beforehand. According to their addresses in our records, all 11 still lived in the Winston-Salem area. I sat alone in my office late that night, staring at the list of 11 names on my computer screen, and realized I was looking at something that medical science couldn't explain. Something that perhaps was never meant to be explained. The human heart is a biological pump that evolved over millions of years. It's imperfect, invariable, and wonderfully alive. What I'd seen in Cameron Dalton's chest was something else entirely. Something that looked like a heart, functioned as a heart, but operated by fundamentally different rules. And whatever it was changing people, improving them, optimizing them, as Cameron had said. But for what purpose? I couldn't begin to guess. On November 7th, I submitted my letter of resignation to Carolina Regional Medical Center. I told the hospital administration I was retiring early for personal reasons, to spend more time with family. After 22 years of service, they didn't question it too deeply. They threw me a small retirement party. My colleagues gave speeches about what a fine surgeon I'd been. Everyone wished me well, but the real reason I left is because I could no longer stand at an operating table without wondering if the heart I was looking at was truly human, or if it was something else wearing a perfect biological disguise. I couldn't trust my own professional judgment anymore. I couldn't rely on the foundational principles I'd spent my entire career building my practice upon. Dr. Turner came to see me on my last day. "Dr. Miles, was it really because of those cases, Cameron Dalton and Olivia Brooks?" "Those cases and the others like them," I said. Sophia, during your career, you're going to encounter things that don't make sense according to everything you've learned. The question you'll have to answer is whether you acknowledge what you've seen or whether you convince yourself you must have been mistaken. Which one are you doing? She asked. I honestly don't know, I told her. My last day at Carolina Regional was November 15th. I cleaned out my office, said my goodbyes to people who'd become like family over 2 decades, and walked out of the hospital where I'd spent the best years of my professional life. I haven't performed surgery since that day. I still live in Winston-Salem. Karen and I are doing fine. I spend time with our daughters and grandchildren. I've taken up woodworking in my garage. To everyone who knows me, I'm just a retired surgeon enjoying a well-earned rest. But sometimes I see Cameron Dalton around town. He looks vibrant, successful, healthy. He always waves and smiles when he recognizes me. And every single time, I notice the way his eyes track movement with slightly too much precision. The way his gestures are just marginally too efficient and controlled. And I've started noticing other people with those same qualities. At the grocery store, walking through the mall, sitting in restaurants. That same subtle optimization, that same barely perceptible mechanical efficiency underlying their movements and behaviors. Maybe I'm just paranoid now. Maybe I'm seeing patterns that don't actually exist. Maybe spending 22 years in high-stress cardiac surgery finally caught up with me. Or maybe I finally saw something that was always there, hiding in plain sight among us. And I just happened to be one of the few people whose job required them to look inside. I think about the other cardiac surgeons out there, performing surgeries every single day, following the same protocols that work 99.9% of the time. I wonder how many of them have encountered what I encountered and simply convinced themselves it was nothing. I wonder how many impossible hearts are beating in human chests right now, never missing a beat, perfectly optimized, waiting for whatever changed them to reveal its ultimate purpose. The human heart beats roughly 100,000 times every day. Cameron Dalton's heart beats exactly 136,800 times per day, 72 beats per minute, every single minute, without variation, forever. I know this because I've done the mathematics, and once you've witnessed something truly impossible with your own eyes, you cannot stop yourself from calculating the implications. I don't sleep well anymore. When I close my eyes at night, I see hearts beating with mechanical perfection, gray and cold and flawless. I see people walking around with something other than biology keeping them alive. And I wonder what happens when whatever is inside them decides it no longer needs to pretend. But mostly I wonder about the question that haunts me every single day. In 22 years and over 5,000 operations, how many times did I hold one of those impossible hearts in my hands without realizing what I was really looking at? How many times did I close someone's chest and send them back into the world, never knowing they become something other than entirely human? That answer frightens me far more than the mystery itself.